Hi, and welcome back to Abnormal Psychology. As you can see from our last chapter last week, it's not easy to determine what behaviors meet the criteria of a psychological disorder, which does or which doesn't. For example, one psychiatrist's definition for psychological impairment might be very different from another's. To standardize the diagnosis process, the American Psychiatric Association, yes, the same folks that brought you the APA formatting for your comm classes, has created a manual of mental disorders, the DSM-5. The 5 indicates the 5th edition. The first edition was in 1952. We're going to look at a variety of methods of assessments that clinicians use to arrive at a diagnosis. A good assessment will classify, gather comprehensive information regarding personality and cognition. All information gathered will help recommend the best treatment as well. So let's begin. We're going to start with the interview. Each interview can vary based on a clinician and reason for the assessment. Interviews can include topics such as identifying the demographic data or description of the presenting issues, psychosocial history, medical psychiatric history, medical problems and medications, etc. The interview can come in 3 different forms, and it kind of really depends on what it is you're trying to achieve. There's the structured interview, that's standardized. There's the semi-structured, and then there's the unstructured. Now, the most widely used method of assessment, the clinical interview, involves the use of a set of questions designed to elicit relevant information from people seeking treatment. Clinicians generally use a structured interview, which consists of a fairly standard series of questions to gather a wide range of information concerning presenting problems or complaints, present circumstances, and history. First, a face-to-face setting allows clients to describe their presenting complaints in their own words. Second, the clinician may observe a variety of nonverbal behaviors, which will also provide clues as to the client's personality and problem. And 3, the interviewer may orientate the interview to the person rather than vice versa. At the same time, a major disadvantage of interviews is that the data may be distorted by a particular question asked, as well as the interviewer's personal and cultural biases. Now, when we think of these questions, or if you will, there are the use of both open and closed questions. Now, open questions require that the respondent answer in a descriptive manner, in their own words. How have your moods been lately is an open question, because it asks you to fill in the answer with whatever comments make the most sense. A closed question, basically requires a yes or no response. Have you had any periods of crying or tearfulness in the last 2 weeks? That requires a yes or a no. Psychological tests are administered. There could be intelligence, personality tests that are structured and standardized. They're tested over a large number of people, creating norms. That's what standardized means. It could be measuring relatively stable traits of intelligence and personality, and must be reliable and valid. We'll get into that in a bit. These tests can then provide some insights as to what is normal and what is abnormal. Intelligence tests help us clarify issues of abnormal behavior. Tests of intelligence, like the Stanford-Binet, 1 IQ score for intelligence, and the Wechsler scale, where it has multiple scores on aspects of intelligence, are used for various purposes in clinical assessments. This includes determining evidence of intellectual delays or cognitive impairments, and assessing strengths and weaknesses. Intelligence is expressed in the form of an intelligence quotient, or IQ. There are two types of formal tests to assess personality. The first is self-reporting, or objective tests. Personality inventories like the MMPI, or it's known as the Minnesota Multiphasic Personality Inventory. And it uses structured items to measure various personality traits such as anxiety, depression, and masculinity and femininity. These tests are considered objective in the sense that they make use of a limited range of possible responses to items and an empirical or objective method to test construction. Second type of tests are known as projective personality tests. The Rorschach and the TAT, which is also known as the Thematic Appreciation Test. They ask the subjects to interpret ambiguous stimuli in the belief that their own answers will be shedding light on the unconscious processes going on within them. These tests as well tend to project our own objectives and needs and desires into the presented stimuli. You can see by the image behind me, you might get an image like that and you're asked to tell a story or tell what happened before or what will happen next. A practitioner may ask for the response to a TAT card or some ambiguous scene in a magazine involving more than one people. Then display the picture and ask the participants to write a paragraph or so in response to the following questions. What are the people in this picture doing? What are they saying to each other? And how do you think this situation will turn out? Then the participant is asked to share their responses. You'll usually find the responses vary considerably from one person to another, illustrating how each of us tends to project our own motives and feelings into the figure showing. You may point out that it's the common themes in the person's responses to a series of pictures that provide important clues to his or her personality, not simply the responses to a given picture. Now next are some methods of neuropsychological assessments to help determine organic basis for impaired behavior and psychological functioning. The MRI, magnetic resonance imaging, and the CT, computerized tomography, can determine both if the brain is damaged and if the damage, where is the damage. The Lura, Nebraska test battery, it's based on work by Alexandra Lura, and his work is a sophisticated battery of tests measuring various perceptual, intellectual, and motor skills and performance, testing for brain function and brain malfunction without surgery. In behavioral assessments, test response are taken as samples of behavior rather than a sign of underlying traits or dispositions. The behavioral examiner may conduct a formal assessment which relates to the problem behavior, to its antecedents, things that precede that behavior, and consequences to things that follow that behavior. Methods of behavioral assessment include behavioral interviewing, self-monitoring, the use of analog or contrived measures, direct observation, and behavior rating scales. Focus on the objective recording and/or description of behavior. Often a functional analysis will be used. A is the situation, B is what's seen and heard, and C is the reinforcer. Direct observation or via a behavioral interview. Now the use of self-monitoring, where a person would record or monitor their own behavior, like a diary. This can be very accurate of what is happening, when, and under what circumstances. These need to be create a baseline, which is what's the level of behavior before treatment in order to compare what the level of behavior is after treatment. Another method is the analog measures, and these can include role playing, where a client can practice a strategy, Some phobia can be used in stages or levels of approaching what one fears, and is an example of that. Behavioral rating scales are checklists providing data about frequency, intensity, and range of behavior problems. Now, cognitive assessments. Now remember, cognitive and thinking are kind of the same. So when we think cognitive assessments, we're talking about our thinking. And it focuses on measurement of our thoughts, beliefs, and attitudes in order to help identify distorted thinking patterns, putting people at higher risk for developing emotional problems. The aim is identifying distorted thinking and replacing it with self-enhancing, rational thought patterns. Now, the specific methods of assessments can include the use of thought records or diaries, and the use of rating scales such as the Autonomic Thought Questionnaire, ATQ-30. Another measure to be gathered is that of the physiological functioning, including heart rate, blood pressure, galvanized skin response, that's the GSR, muscle tension, and brain wave activity. Now, to measure things like that, we're using the electroencephalograph, or the EEG, which measures brain waves, and the electromyograph, EMG, which measures muscle tension. In addition, there could be some probing. There can be some brain probing or using brain imaging techniques such as EEG, CAT scans, PET scans, MRI, fMRI, beam, and MEG to probe the different inner workings of the structures of the brain. You'll see a summary of all these in your textbook, but we're getting much more robust information from some of the technologies that we can use to see the workings of the brain that we couldn't otherwise see. This brings us to an end to part 1 on chapter 2. In part 2, we're going to explore the DSM-5 and the theoretical perspectives on treatment or therapy for psychological disorders. Okay, so we'll see you in part 2. Bye for now.